Jan, good to see you again. Thanks for joining us here on Health Connection. Our topic is acid reflux, and not to underestimate the impact that disease can have. So let's get a definition out of the way. What is acid reflux, and is it the same as what we commonly call heartburn?
Technically they're different, but most people use the terms interchangeably. And if you think of it, acid reflux is more the splashing of the stomach acid up into the esophagus.
And how is that different than heartburn? Or is it enough difference to make any difference?
Probably not going to make a big difference to anybody but me, but heartburn is what you feel. It's that uncomfortable burning feeling in the middle of your chest.
Okay. It seems to be so much more common than it was a decade ago. Is there a reason for the increase?
Well, there's a couple reasons. One of them is our lifestyle is very different. We're always in a hurry. We tend to supersize all our meals and overeat. We eat several huge meals instead of frequent small meals, and the incidence of obesity has risen dramatically. And the pressure on that valve at the top of the stomach is increased enough from obesity that a lot of people have symptoms of acid reflux.
Okay. Explain how the different categories of medications for acid reflux work.
Good question. Some of the more simple ones are antacids, and those are the things that as you eat them and they drop into the stomach, they actually neutralize the acid in the stomach. There are other ones that create a foam barrier, like Gaviscon. As it gets into the stomach, it floats to the top and it provides a physical barrier so that acid doesn't splash up into the esophagus. There are medications that you can buy over the counter that we call H2 blockers, and what they do is they put the acid pumps in your stomach to sleep. Zantac is a very common example of an H2 blocker. One of the ones we like to use a lot is a proton pump inhibitor, which is another fancy name for a medicine that puts the acid pumps in your stomach to sleep. Things like Protonix, Prevacid, Nexium are all in those categories. And they not only put the acid pumps to sleep, they actually can help with healing if there's any break in the mucous membrane.
Okay, you just mentioned Nexium. Let's talk about those kinds of drugs, Pepcid AC, Prilosec, Nexium, versus antacids. How do I decide which to take when?
It's a personal decision based on how often are you having these symptoms. If it's just once in a while, you might try something simple like Tums. See if that's enough to take care of your symptoms. If you have symptoms more frequently, or you're eating a meal that you know is going to aggravate your reflux, you may want to pre-medicate about 30 minutes before your meal of, say, Mexican food to try to prevent it from happening. A lot of it depends on what's convenient for you to use and how often you have symptoms.
Okay. Are there side effects associated with overusing prescription drugs like Pepcid AC, Zantac?
Absolutely. There's some new studies out that have noted an association between fractures of the wrist, the hip, with long-term use of proton pump inhibitors such as Nexium. There's also some data that suggests that the incidence of pneumonia is more frequent in people who've been on proton pump inhibitors for a long time. And then there's an infection in the colon called C. difficile that is on the rise, and there is an association between acid inhibition and this infection.
Just to follow up on that, the next question is, we've said you just mentioned increased risk for pneumonia, but also you said fractures. There's also been mentioned dementia and as a potential side effect for taking drugs like Nexium, Prilosec, Prevacid. So with all that in mind, how long is too long to use these medications?
That's a great question. The studies are still going on. There are some suggestions that if you've been on it more than a year, you should really look and see, do you still need that medication? With a lot of my patients, their symptoms are not every day, forever. And so you may find that you are able to trial off your medication without having a recurrence of your reflux symptoms, but you may want to talk to your provider about ways to do that safely.
Following up on the taking medication, should people with acid reflux who take prescription drugs for long periods of time be concerned about any increased risk of side effects or other problems.
Absolutely. Any prescription drug is probably going to have a side effect or two. It may be something as simple as diarrhea or constipation. It may be something that takes a while to develop, like a vitamin or mineral deficiency. And I think anytime you take something long term, you should ask a lot of questions on, is there something I should change in my diet? Is there something I should supplement?
Okay. By the same token, if we're afraid of over-medicating, what are the risks of not treating acid reflux?
Great question. Under treatment, the first one is pain, discomfort. You can have nausea, persistent heartburn. It can keep you from sleeping well. You can also have actual damage to the tissues within the esophagus or the stomach, where you could have an ulcer. You could have an ulcer that heals, but it leaves scar tissue behind, and as that scar tissue contracts, it can leave a stricture or a narrow place that makes it hard for you to swallow.
What do you consider to be a common sense approach to the use of medications for treating acid reflux?
I'm glad you asked that. The first thing is you need to take care of the things that are within your control. There is not a pill that's going to take care of everything. If you're overweight, it would be wonderful on so many levels if you could try to lose weight. That will reduce the pressure on that muscle ring at the top of your stomach. The second thing is, if your diet is terrible, change it. If you eat a lot of caffeine, coffee, sodas, things like that, you need to cut back by half. If you know what your trigger foods are, like, for example, a lot of people have trouble with Mexican food. Well, then it doesn't need to be an every week part of your diet. You may need to change or modify your diet. Watch what you use for snacks. Carbonated drinks are notorious for increasing the pressure within your stomach, and it propels the acid farther up your esophagus. Make a switch to something that's not carbonated. After you've done the things that are within your power, and if you're still not successful, you might want to seek additional things from your drugstore. Start with antacids. See if that's enough to take care of your symptoms. If that doesn't work, you might try something like Zantac before you know you're going to have a troublesome meal. Reduce the amount of food that you have in your stomach before you go to bed at night. With a full stomach and a valve at the top of the stomach that doesn't close completely, when you fill your stomach and lay down, a lot of that can slip up the esophagus and damage your esophagus all night long. And you may be tired enough that you'll sleep right through it, but the damage continues and you may feel the symptoms of it the next day. You can help that by not eating or drinking within 2 hours of laying down. Something else that you can do is boost the head of your bed by placing a 6-inch block under the headboard only, so that your head is elevated while you're sleeping.
Very well, Jan. Good to see you again. Thank you.